Mario's question is, how does he know if his metabolism is the problem?
That's actually, Mario, good evening. This is actually a very common question we get. So, definitely, people with obesity do have slow metabolism. It's not just you. 80% of the way you look is genetics. So that's the 80% part we can't change. The ball that we have in our court is the 20%, which is environmental factors, socioeconomic factors, personal factors, how much effort you put into losing weight, and the support you need. So we're here for the support card. Um, the genetics we're not going to change, right? Um, so depending on what your individual situation is, we can discuss. If you want to, we could do it one-on-one as a telemed, or you walk office and speak. Or if you're willing to talk about your personal weight loss issues, we'll be happy to address it at the forum. Let's go around the table and introduce ourselves so we can get to know each other and see what anybody's needs are that I may be able to address and help. Gabriella, you want to start?
There is another question from Facebook
Yeah.
from Angela. Will I need vitamins or supplements for life after surgery? I'm always worried I'll have to take pills for life.
Um, that's yes, it's true, Angela. Especially for people who undergo gastric bypass, that the portion of the small bowel that we bypass, that's where most of the vitamins are absorbed. So we generally recommend people taking a multivitamin, calcium, and B12 for lifelong. Having said that, um, even if you comply with it partially, meaning taking it every 2 or 3 days, or if you skip a day or here and there, it's not the end of the world. But we do 6 monthly and 1 yearly annual lab exams and make sure that you don't have any vitamin deficiencies, and if you do, we can fix it. So to answer your question in a short form, yes, you do need vitamins. You're substituting your blood pressure pills, your diabetes medications, or your cholesterol pills for a multivitamin once a day. I would do it all day long.
Thank you so much. We have Mr. Emmanuel Charles joining us. Thank you for joining us, Mr. Emmanuel. We have Dr. Khan, one of our surgeons from IBI Healthcare. Do you have any questions you would like to ask him? Or if anyone has any questions, they feel free to ask. Now's the opportunity.
Does any of the participants have any questions that I can help answer?
Hello.
Hi there.
Hello.
Sorry, I think that was a mistake.
Do any of you folks have any questions that I can help address about your weight loss journey?
Miss Linda has a question from Facebook. What can I eat after surgery or ESG?
So generally, what we do after any surgery, be it ESG or LSG, we start the liquid diet a week after the procedure. The same diet that we asked you to do before the surgery, which is liquid diet, we continue a week after, and then we gradually advance for clear liquids to full liquids the following week, soft mushy foods the third week, and you can eat solid foods the fourth week. When you start your solids, that's when you start your vitamins, and you have to chew your foods really well, so that things don't get stuck. That's the general progression for all the surgeries we offer, be it ESG, LSG, bypass, revision, any surgery. Anybody else have any questions? Folks, this is an open forum. Feel free to ask any questions that you may have. We're here to support you, to answer any questions, and help you get through the finish line, whatever that might be for you. Anika, I don't have access to the whole thing. Can you read that last statement?
Yes, absolutely. So someone asked, weight loss surgery versus GLP-1, which option is more suitable?
So that's actually a good question. The GLP-1s are really in the limelight lately. Generally, a simple rule of thumb for people with a body mass index above 40, they at some point, if not sooner rather than later, will end up requiring surgery. Anybody below that BMI, they're welcome to try the GLP-1 analogs. They work amazing. They do well, but it's not meant for everybody. So people with super obesity, people with intractable reflux, they are the best candidates for surgery, even without trying GLP-1 analogs.
Another question is, are there guarantees after the surgery that one will not die?
um, Generally, the risk of dying from any weight loss surgery is 0.01%. So less than 1 in 100,000 people end up developing some sort of a serious side effect to a point where they can die. Any surgery is risky, but generally, if surgery is done by somebody who is trained, has a reputation, and have enough years of experience, and works at a center that is a center of excellence, the risk of dying is so negligible that we don't even put it as a complication known to the surgery. So it's a very safe, effective surgery.
All right. There's another question for Silva. The question is, I would like to know if my stress level will go down if I am able to lose weight.
Um, Gosh, That's a curveball. So if your stress is related to your weight, sure. If your self confidence is related to your weight, sure. If any of the medical problems that you suffer from, be it diabetes, blood pressure, sleep apnea, acid reflux, sure, all of these things will get down. If you have a type A personality and are generally stressed, even without being overweight, I seriously would doubt that the surgery is going to make that any better. I hope it helps.
Anyone else have any other questions? Thank you so much for answering those, Dr. Khan.
Hmm.
Which weight loss surgery is best for long-term results?
So there's several weight loss surgeries that we offer. We offer a laparoscopic sleeve, which is probably the number one surgery being offered across the globe right now. We are one of the few centers who offer this surgery both laparoscopically and endoscopically. So it depends on an individual, each surgery. No surgery is perfect for every patient. For patients with diabetes, patient with acid reflux, gastric bypass is the gold standard, has been and always will be. For patients with morbid obesity without having acid reflux and diabetes, a gastric sleeve will do the job, provided you put in your effort. So, making good food choices, follow up with your physician, uh, regular exercise, giving up your sodas, diet sodas, and containing your carbohydrate intake, you can do equally well with the sleeve or the bypass if you're committed to it.
Another question from Facebook. How do I prevent regain after losing it? Losing weight, regaining weight after losing it.
Yeah. So statistically, what happens is, and it's been studied very extensively, most people will notice what's called weight recidivism or weight regain 4 to 5 years after the surgery. And I have family members in that group that I know personally who've had surgery, some of them by me. In 5 years, they'll notice that the weight is coming back. And the reason for the weight regain, to give you a short answer, is not caring for what you have cared for in the past 4 years, meaning letting go your diet, letting go your exercise, not keeping up with your doctor's appointments, and generally just letting it go. If you stay focused and you realize you've lost 80, 100, 200 pounds, it's obesity is a lifelong issue. It's not going to go away, but we can put obesity and obesity related medical problems at bay if you uh, stay with the program. So we generally follow our patients for lifelong, once a month for the first 6 months, every 2 or 3 months following that, once a year following that. And generally, people who stay in the program fare better than people who do not. And people who attend these normal follow-up meetings with such as support groups that we host tend to fare better than most other people. Hope that answers your question.
Mark from Instagram has a question.
Yeah.
Can weight loss surgery help me sleep better?
So most to Mark, that's actually a good question. Depends on if you do or don't have sleep apnea. Almost all obese patients tend to have obstructive sleep apnea where they stop breathing in the middle of the night and they wake up gasping. So you end up never getting a restful sleep. So generally, people with high BMI or any suspicions of sleep apnea, we get a sleep study. If you do have sleep apnea, you probably are best served by having a CPAP before we actually do your surgery. And after weight loss, you can come off the CPAP rather rapidly in the 3-6 month period. Majority of the people come off of the sleep apnea machine.
Edor has a question from Instagram.
Yeah.
Are weight loss injections safe, and I guess are they working faster? Do they work faster than pills, like
Uh,
phentermine?
uh, the answer to the question is yes, they're both safe and they do work faster than the pills. But um, if you didn't join us earlier, Igor, I can tell you that the injections are not meant for everybody. So people with BMI under 35 tend to benefit from the weight loss injections more. You have to realize that the long term, you have to be committed to it for lifelong. The moment you stop the weight loss injections, the appetite comes back with the vengeance and you gain the weight back and sometimes more. So depending on your individual situation, if you have the 20, 30, 40 pounds to lose, yeah, weight loss injections are great. But if you have more than that, then surgery ultimately is going to be needed. There are some side effects to the weight loss injections. There's we don't have long-term literature available on the GLP-1 analogs, but whatever data we have available, there's risk of getting inflammation of the pancreas called pancreatitis. There's some people getting issues with their eyes. There's long-term nausea, vomiting that can happen because it causes um, gastroparesis, meaning slowing down of the stomach. So if you plan on using these injections for long term, you have to be aware of all of these side effects, and not to mention the cost.
Well said, Dr. Khan. Question from Facebook. How do I know if I'm a candidate for weight loss surgery?
So generally, we use what's called the NIH criteria for weight loss surgery, and that's what's covered by the insurance company. If you're going to go through your insurance company, your body mass index, which you can easily calculate, just put it in Google, your height and weight in kilograms and meter, and your height in meters squared, you'll get the body mass index. If your BMI is above 35 and you happen to have diabetes, blood pressure, sleep apnea, um, polycystic ovarian syndrome, arthritis of the weight bearing joints, you qualify. Or if your BMI is above 40, you don't need to have any of these comorbidities. So, anybody above BMI with 35 and above with medical problems or without medical problems, you need to be a BMI of 40 and above. If you wish to go self pay and don't want to go through your insurance company, any BMI that is out there, as long as you're obese, um, we entertain that.
Just to piggyback off of Dr. Khan, I did put our telephone number in the chat. Feel free to reach out to us if you would like a consultation with myself or one of the surgeons. We can always, discuss what options best for you, and plan basically a pathway for you to help you with your weight loss. Anyone else have any questions? I did see Miss Faith. Thank you for joining us. Did you have any questions? We have one of our surgeons, Dr. Khan, on the line. If you wanted to ask him anything, definitely can ask him now. Another question from Facebook. Does taking GLP-1 medication worsen acid reflux symptoms?
Yes, it does. So the way GLP-1s work is it slows the stomach down. So anybody with pre-existing acid reflux, with stomach not even working, and with a incompetent esophageal sphincter, lower esophageal sphincter, reflux and nausea will worsen.
Thank you for answering that. There's another follow-up question from Instagram. I want to know more about non-surgical methods for weight loss besides taking pills.
Wow. So um, that's lifestyle modification, my friend. So watching your carbohydrate intake, meaning cutting out the carbs from your diet, which are breads, rice, tortillas, pastas, and pizzas. These are pure carbs. They're the reason why America is where it is. If you cut the carbs out, concentrate on a high protein diet, and limit your calorie intake to 1,200 calories a day. Easier said than done, but that's the only real known mechanism how you can not gain the weight. Give up your sodas, your alcohol intake. You need to have at least 64 ounces of water every day and log in at least 10,000 steps every day for you to be healthy and not gain weight.
Also, Dr. Khan definitely provided, very educational information. We do offer non-invasive procedures like the gastric balloon, which is not surgical. It's more of a placement of a balloon inside your stomach for a course of 1 year. That can help with weight loss as well. It's something that's just a tool that can kind of help, facilitate weight loss. That is an option available if you don't want to go with the surgical option.
Yep.
Miss Faith, thank you for joining us. Anyone else have any other questions? Either from Facebook, Instagram, or even on our meeting on Google. Overall, very good questions, everyone.
Folks, feel free to ask any questions. This is an open forum.
Mhm.
Doesn't matter what stage of your weight loss surgery you're in. We're here to support you and walk you through whatever questions you may have.
And if you're not comfortable talking, you can always put in the chat too. I can definitely read the questions out. Question from Facebook. What happens to my weight when I stop taking GLP-1?
Hmm. That's $1 million question. So GLP-1s, the way they work is they have two mechanisms of action. They suppress your appetite in your brain, and they cause what's called gastroparesis, or they slow your stomach down. When you stop taking the medications, both of them return, and you're back to square one. So it's a short-term solution. It's an effective way of losing weight, but it's a commitment for a long time, if not lifelong.
Anyone else with any questions that we can address?
I think that's pretty much it, Anik. Let's call it
Sounds good.
night.
Sounds good. So I'm gonna leave our phone number. You can feel free to reach out to us. Once again, I'll say it. It's 678-466-6760. 678-466-6760. Feel free to reach out to us. We make a consultation if you have any questions. We can address them. Our website is ibihealthcare.com. It has a lot of useful information on there. It talks about the procedures, a lot of questions you might have, and a lot of pictures to kind of illustrate what kind of procedures we take care of. Dr. Khan, myself, and other doctors, including Dr. Chris, are available to answer questions. We did have one more question, Dr. Khan, that just came in.
Sure.
How common is weight regain after gastric sleeve surgery?
So it's actually fairly common. A good 30 to 35% of the patients will gain the weight back after they've lost a significant amount of weight. And again, I'm going to reiterate, if you're if you go back to your old eating habits, over time, what happens is your stomach does dilate, and you do end up going back to your old eating habits. And not just that, you can consume your calories by drinking liquid. So if you drink 1,000 calorie frappuccino from Starbucks, there's not much I can do. So it's a lifestyle modification. It's keeping in touch with your bariatric surgeon for lifelong, and not reverting back to your old eating habits. That's what's going to keep the weight off long term. But there is a certain incidence of regaining the weight, not all the way, but partially with the gastric sleeve, even with a gastric bypass. So, to sum it up, you really have to be committed to weight loss journey lifelong and keep in touch with your surgeon lifelong.
Thank you so much. One more question. Do you have any provisions in case one will like to travel?
Yeah. So we own a surgery center in Loganville. We do a bunch of patients from out of town. What we do is we have you come in the night before uh, into town. We do the surgery generally on Tuesdays or Thursdays. So you spend a night before your actual surgery. You get your surgery done the following day, and then spend another night. And then the following day, if it's Wednesday or Friday, you come back to the office, get fluids, and you can head back to town.
And we can always provide you accommodation as well as which hotel to stay at, where we're located. Our team is really good about everything that you need preoperatively to make sure that everything is smooth. But we do have patients that come in from out of town regularly, and of course, at least a minimum of 3 days they stay. One day before the surgery, the day of the surgery, and one day post-op to make sure everything is okay before traveling back to where they came from.
That's for your own safety.
Yes, absolutely. Any other final questions before we kind of close this support group for this evening? All right. Once again, I would like to take this opportunity to thank Dr. Khan for taking the time out to answer everyone's question. Thank you to all the participants for joining us tonight. Hopefully, this was an educational support group for y'all. Feel free to reach out to us anytime. We can answer any questions y'all have via email, our website, or even phone call. And if you have texting the WhatsApp or texting number, let me check on that. I can give that information shortly. We usually have the phone number direct line that I posted on there. It's usually 678-466-6760. If you reach out to them, they can definitely address. And then you can always email at patientexperience@ibihealthcare.com. And we can always answer those questions you might have. I'll put it in the chat so everybody has it. So feel free to reach out to us via email as well. But once again, thank you everyone for joining us tonight. We usually host these the third Tuesdays at 6:30 every month. So for the next one, anticipate looking at it. Let me open my calendar and I can let you know. 1 second. The next one, anticipated around December 23rd at 6:30 p.m. Once again, you can join any of the platforms, Instagram, TikTok, Facebook, or even the Google Hangout, and we can address all your questions that you have. Once again, thank you, Dr. Khan, for joining us tonight and leading the support group. It was a pleasure learning from you.
Thank you, Anik. All right, folks, have a great night.
Have a great night, everyone. Have a great night. Thank you.
Thank you.
Bye-bye.